Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here's Jessica Boyington.
Colorectal cancer, a disease which is on the rise here in the United States, is largely preventable with early screening and detection. Mainline Health is one of the first in the country, though, to have new state-of-the-art technology to help diagnose and treat colorectal cancer in its earliest stages. We're here now today with Dr. Phillip Pearson, colorectal surgeon at Mainline Health. Dr. Pearson, thanks so much for being here with us today.
Thank you so much for having me. I appreciate it.
All right, let's get right down to the topic at hand. Who is at risk for developing colorectal cancer?
Well, it's funny you mentioned that because 5 years ago, the answer would have been people over 50 in the United States of America. And 5 years ago, a bunch of new data came out from the researchers across the country. And all of a sudden, there was a new number. And the new number 5 years ago was 45 years old. And I will say that just last week, another article was released by the American Cancer Society. For some reason, colorectal cancer is showing up in younger and younger people. We don't really know why, but that makes it even more important for people over 45 to get screened for colon cancer.
Right. So obviously those screenings, like you said, are really important. Why are they so important in the successful treatment for this kind of cancer?
Number one, if we find it early, then it's much more treatable and the survival is much better. And so you find the cancer at an earlier stage, and therefore people just do better. The other thing is that colonoscopy specifically is really kind of an amazing screening test. We can do a colonoscopy on a 45-year-old person, asymptomatic, no problems. And if I find a polyp, I can actually grab that polyp at that moment and remove it. I can take it out of the colon. It takes 2 seconds. And then what's even more amazing is that polyp might turn into a colon cancer in 5 or 10 years. But because I took it out, I could be preventing colon cancer for that person just because they came in for a routine colonoscopy.
Well, okay. So obviously now we know that colonoscopies are very important, but I would bet my life that a lot of people are really anxious and nervous about going in to get one. What do you want everyone to know about the procedure to kind of, ease their minds?
Well, you've hit upon a touchy topic. Nobody wants to get a colonoscopy, that is for sure. And I think there's really two reasons why. One is probably, honestly, you have to clear out the colon so that I can see what I'm doing when I'm doing the test. And in order to clear out the colon, you have to go to the bathroom a lot. I know it's not that fun, but it also is not a big deal. It's a little inconvenient. And the second thing is, I think people are embarrassed and they think that we might be looking at that part of the body. When we do a colonoscopy, we're looking at its screen for about 30 minutes. So hopefully you can put that out of your mind and get over the anxiety and just go get a colonoscopy because it's so important for preventing colon cancer.
Right. Just get over it is going to be the lesson learned here. So Mainline Health has some advancements being made in the treatment for colorectal cancer. Can you tell us about some of those?
Well, as a surgeon, I'm mostly focused on the surgical advancements, and there are a few of those. I would say that about 90% of our colon cancer and rectal cancer surgeries these days in Mainline Health are done minimally invasively. And what that means is they're done laparoscopically. There's another form of laparoscopic surgery, which is called robotic surgery. Robotic has some advantages for some patients, but as a patient, I wouldn't sweat it. We're all working very hard to do the same operation with smaller and smaller incisions so you can go home and get back to your life faster.
You know what? I think you probably calmed a lot of nerves today talking about this. So thank you so much for sharing all of this with us.
Thanks so much for having me.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.